As restorative dentists, one of the most challenging things is to communicate the shade effectively to the lab. And you may be doing this in a couple of ways. One, you might be eyeballing it. You may just be using a shade guide and telling the lab that this is shade A2 or D2 or whatever. That's the least accurate. Some of you may be using your mobile phones and you may be taking some photographs to communicate this to the lab as well. That's not so accurate as well because cell phone manufacturers apply various algorithms to the image to make them look pleasing in a certain way. But the problem with that is it is not very realistic. It's not exactly what we want. We need accurate information to send to the lab. So that's when you start to use a DSLR. So now it's not just about having a fancy camera to take these images, because we need to calibrate this camera to make sure that we are sending accurate shade information to our labs. And how do we do that? We use something called an 18% gray card. The 18% gray card is a card where it is calibrated to be at the midpoint between the darkest shadows and the lightest highlights, and the camera knows exactly what an 18% gray card is supposed to look like. So we would use this when we do our shade selection. Stay tuned for the next reel so that you can get a practical demonstration on how to use this gray card when you are performing shade selection with your patients, so that you can communicate to the lab effectively and have less problems at the delivery appointment. I hope I've confused you enough. This is the Dental Review Guy signing off with a smile.